This week we are also going to be thinking and talking about the ethical considerations for assessment. So when we're talking about assessment in education, we're specifically referring to the wide variety of methods or tools that teachers and other educators use to evaluate, to measure, to document the academic readiness, the learning progress, the skill acquisition, and the educational needs of students. Now with assessment, it can take lots of forms. It could be a standardized formal assessment, or it could be an informal criterion referenced assessment. The thing is, there's no single test or assessment that can demonstrate a child's full range of abilities or challenges, and a variety of educators often contribute to the overall assessment process. So it's that interdisciplinary team and not just one person. Depending on the state, the special educator's involvement with the diagnostic evaluation can vary. Sometimes the special educator does all of the diagnostic assessment, and some states will have rules about certain people like psychometrists who do all of the diagnostic assessments, and special educators interpret that data. It really is varying from place to place. So you want to check in your district what the rules are and who the professionals are that engage in the diagnostic assessment and interpretation of that data. However, even if you don't give those diagnostic assessments, as a special educator, you need to be fully aware of and fully understand diagnosis, the diagnostic process, and eligibility for each disability. And we talked about that in Chapter 1. If you don't really thoroughly understand this, you can't ever really understand disability, how it affects the child, or even the decisions that we make and why we should make them when we're planning for instruction. So for this chapter, I want to go over the learning objectives. So first, you need to be able to define assessment in an educational context. As you're reading, make sure that you can go back and present your own definition of this that makes sense and that aligns closely with the actual definition from the text. Second, you want to be able to make sure at the end of this week that you can distinguish between the purposes of assessment, screening, pre-referral considerations, diagnosis, eligibility, and the relationship between instruction and assessment. So make sure you've got all those terms down and that you can differentiate between the two. Third, I want you to be able to explain the multi-tiered system of support and response to intervention. We just MTSS and RTI. Make sure that you can explain what those are and what those look like in an educational context. Then you should be able to discuss progress monitoring and benchmarks and how they apply to the assessment process. You should be able to investigate the considerations for students from culturally and linguistic diverse backgrounds during the assessment process. Several of you talked about how you wanted to be able to know if an assessment was biased or if you were assessing in a biased way, particularly for students from culturally and linguistically diverse backgrounds. This is important. So make sure that you can discuss that and understand the differences. And then finally, you should be able to really examine the ethical considerations surrounding assessment. This refers to everything from culturally and linguistically diverse students and how we affect bias, and also what it means for students who come from poverty, what it means for students who haven't had educational experiences, what it means to use one assessment versus multiple assessments, standardized versus non-standardized, all of those different considerations. And then also look at page 23 in your textbook. I recommend creating some flashcards as a study tool. Make sure that you can consistently and correctly use those terms, okay? So looking to the chapter, remember assessment in education, we gave this definition earlier, but it refers to the variety of methods and tools that we use to evaluate, measure, and document the academic readiness, the learning progress, the skill acquisition, and just the educational needs of students. So why are we doing assessment? Well, we're going to do it for several reasons. First, it's part of the screening process. This is also the step that we need for pre-referral. We need assessment for diagnosis and eligibility, and we need assessment to guide our instruction. Let's start with screening. Screening is the process that alerts us, educators, and also medical professionals to any developmental problems that our students might experience, and this suggests whether or not we need more in-depth evaluation. Now, most public schools screen children for developmental problems that put them at risk for school failure. And the screening usually occurs in large numbers, and it's not a precise process. This might look like your MAP data that people take 3 times a year. There are some common characteristics among those screening instruments, and it can be paper pencil test, it could be checklist, it could be rating scales, or even observations. With regard to screening and eligibility, we have to be careful not to infer too much about eligibility because IDEA specifically states the screening of a student by a teacher or specialist to determine appropriate instructional strategies for curriculum implementation shall not be considered to be an evaluation for eligibility for special education and related services. So public schools are responsible for the screening of children for suspected disabilities. This is the primary function of Child Find. And Child Find requires that all school districts in the U.S. identify, locate, and evaluate children with disabilities starting from birth through age 21. Now, medical professionals also conduct some screenings to determine how children are developing, and young children have to go through periodic screenings with their well child visits. These are usually pretty brief, and the parents just complete questionnaires. The American Academy of Pediatrics recommends that children are screened at 9 months, 18 months, and either 24 or 30 months. Now, you should note that autism-specific screenings have been added to the list of recommended screening tools. So let's look at the next purpose of assessment, which is pre-referral consideration. It's the preliminary process by which we're using evidence-based strategies and accommodations in the general education classroom with general education students who are having some academic or behavioral or even social challenges. The primary goal of the pre-referral is to resolve any existing challenges that a student might demonstrate before we actually refer to special education for that student. Sometimes a child's difficulties can be remedied just by providing accommodations like preferential seating or even using an alternative teaching method. Other times, we go ahead and refer to special education for a comprehensive diagnostic evaluation if that's needed. Now, with the pre-referral teams, IDEA doesn't require schools to have a pre-referral team, although a lot of school districts do have pre-referral teams, and they're called by lots of different names. Members of the pre-referral team often include individuals similar to those on the IEP team, like we usually have general education teachers, sometimes we have parents, there's almost always a special education teacher, an administrator, and usually a school psychologist or guidance counselor, whoever does a lot of the assessments. And if a parent makes an official request for a comprehensive evaluation, this will bypass the pre-referral process entirely. The pre-referral process occurs across a series of 6 distinct stages that are sequential and developmental in nature. Now let's look at stage 1, the initial concern regarding students' progress. During this stage, the students in the gen ed setting and the teacher or parents have some concerns about performance or behavior. Maybe the student lags academically behind peers in classwork or even a performance on assessments, or the teacher notices behaviors that indicate the student is struggling, or the parents notice that the kid's not interested in school or has a poor self-concept. Then we move to stage 2, information gathering. In this stage, teachers and parents start gathering information about the student's performance. We want to use this information later on to make some educational decisions. We might get some test data, quiz scores, observations, or interviews from parents. The pre-referral team has to examine the student's educational background, or if the student has behavioral challenges, we have to look at past classroom behavior management techniques that have been implemented and the degree to which they were successful. All of this gives us valuable insight into challenges that the student might be presenting. Then we go to stage 3. This is information sharing and team decision. During this stage, the pre-referral team meets and we share information that was gathered about the performance and we make some decisions about how to proceed. The team might share and discuss the test results in a specific academic area, or the parents might inform the team that the child has started taking a new medication that could be affecting learning or behavior. And new evidence-based classroom strategies are often used in the gen ed classroom to help this child succeed. When we get to stage 4, we are discussing possible strategies. We're actually going to identify the specific interventions that we're going to implement, and those interventions are based on the needs of the student. We move to stage 5. This is where we implement the stage and monitor the strategies. The gen ed teacher, with the support of the special education professionals if needed, will then implement whatever interventions we have discussed. We allow time for the new interventions to take effect, and we monitor for effectiveness. And then if it's academics, we use CBM or curriculum-based measurement to track some data. Behavior, we could use data recording sheets. And we take this data to help the pre-referral team determine if there's a way to manage the student's learning or behavioral needs while in general education. Then we move to stage 6, which is evaluation and decision making. In this stage, the team reviews the results of the strategies, we examine the data, and we make some decisions about whether the student can be successful in the gen ed classroom and if there's any changes that we need to address. If the strategies are successful, the kid stays in gen ed and we use the interventions. If the strategies were unsuccessful, the pre-referral team discusses whether or not we're going to have to do a comprehensive diagnostic evaluation to determine if there's a disability, and if so, whether or not the student is eligible for special education services.